Here's what you need to know about eosinophilic esophagitis, also known as EOE. I'm a board-certified allergist immunologist, and I'm going to talk to you as if you were one of my patients in my practice. EOE is a type of inflammatory condition where white blood cells called eosinophils are coating the lining of your esophagus, your food pipe, and it can present with different symptoms depending on the age of the patient. So if you have a young child, they may present with just vomiting, as an example. But as you get older, that can change to have feelings of heartburn, problems swallowing food, also known as dysphagia, or in severe cases, food can get stuck in your esophagus, and we call it food impaction, and somebody has to take a scope and get that food out and then dilate the esophagus in order to treat it. Now, this is a type of food allergy because food can trigger this inflammation that if you get a biopsy of that tissue, you will see a lot of white blood cells occurring, and removal of certain food triggers can reduce that, but it's really hard to figure out what the food trigger is because the traditional allergy skin testing that we do for food allergies, that mechanism, a type 1 IgE-mediated hypersensitivity reaction, doesn't line up well with EOE. That mechanism is a little bit different and is driven by eosinophils. So skin testing is not necessarily helpful, but recent clinical trials suggest that avoidance of milk and/or wheat can help a large number of patients, but others may need to avoid more foods than that. Some patients may need antacid medications like proton pump inhibitors. Some may need to swallow steroids, like taking a steroid inhaler and pumping it multiple times in order to suppress the immune response at the level of the esophagus. And now there's a recent biologic medication called dupilumab that was approved down to age 12 that can help significantly reduce the number of eosinophils. So I hope that this was a helpful introduction to what EOE is. If you have more questions or would like to learn more, feel free to follow for more information.